Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys. Okay, today's episode, I think y'all are really going to enjoy because you get to go through the whole journey with me and with Norma.
Start to finish.
My guest today. So from start to finish, and I'm even going to tell you guys how we ended up even today sitting here because it's just been...
It was kind of like a coincidence, like it just clicked.
It just
literally
clicked. So... Yeah. Norma is my friend. We've been friends from California. We've been friends for a very long time. And I knew she had breast implants. And we've talked through the years about, other than friendship things, but we've talked about surgery. And I know her implants were saline and she's
13 years old.
13 years old. So how did we even end up on this phone call?
I just remember talking to you like, oh, how are you? How's that? Well, I'm at the doctor again and just telling you about all the symptoms I've been experiencing. I'm on this med. I feel hot. I think it was just me talking about my health in general. Mm-hmm. Not even me realizing I wasn't even talking about BII. I was just talking to you about stuff I've been going through health-wise.
Right. That's right. So we had a conversation and she was telling me all of these things that she was experiencing. And it's a lot. Do you even want to give us a little run through?
I think it just clicked for both of us, but I was telling you, the chronic fatigue, the headaches, being diagnosed with lupus, Sjogren's syndrome, and rheumatoid arthritis within maybe a couple years. It was just a lot.
So
at once,
she told me all of these things, and we hung up. Maybe how long? Maybe a week later.
Yeah,
it suddenly clicks for me. Yeah. I'm like, oh. Hold on. Mm-hmm. I've had patients come in, with symptoms for, guys, let me tell y'all first off, BII is a very loaded subject. And I have been trying to find a way to talk about it on the show without scaring y'all and without also saying information that I don't know, because a lot of it is still unknown.
And we still, I don't know how I'm going to feel post-surgery, but it just like you said, it clicked. So when you told me about that and then you called me to tell me about BII, I told you, I literally just read about this, Mavi, and I sent you, I think, a link or something or an Instagram page. And I told you, I literally was just looking at that. How weird is that?
Yeah, that's how it happened.
Exactly. I was just, it clicked to both of us because I was like, wow, I was literally just reading on this. And then you brought it up. I was like, wow.
Yeah. So I called her to tell her, hey, you know what?
Have you ever
thought or looked up BII?
Mm-hmm.
And
I had.
And she had. So that kind of threw us in this journey now where...
A few months later now, I guess.
Yeah, we're a few months later and she's already been to pre-op. So I connected her with Dr. Christy Hustak.
Yes.
And Dr. Hustak is going to be operating on her tomorrow. You guys, so BII, let's just even... go into what is BII. What does that stand for? So it stands for breast implant illness.
Correct.
And the symptoms are, I think, didn't you pull up a list?
Yeah, I actually pulled up a list because when I was reading it, I was like, how is this even possible? There's so many symptoms. And to think that I have most of these, the anxiety, the fatigue, the joint pain, muscle pain, brain fog, it's just a lot of things. Now, keep in mind, I don't have all of these symptoms, but enough for me to kind of, like you said, something clicked in my head where it's like, it can't be a coincidence. There's just too much of this that I have. The autoimmune diseases. It's like, how do I go from being so healthy to now I'm like so ill, and taking all these medications. And for me, it just kept getting worse and worse to where I was like, we got to do something else besides just taking all these pills every day and seeing all these doctors, like something else.
What was it? What you told me earlier, what was that moment where you were like,
So I was at my rheumatologist's office. Like it's every 3 months, the blood work, every 3 months, the rheumatologist, the new meds. And for me, it was becoming more and more to the point where this last time, I guess it was about 3 months ago, my doctor said, the next step is taking chemotherapy, which is not chemotherapy, but a chemotherapy pill. which the side effects from what I read scared me. It scared me enough to say, hold on. To my doctor, I said, let me think of something else. Let me, like regroup and just get my thoughts together to see if this is something I want to do, because it's really serious side effects. And I wasn't ready for that personally, to take chemotherapy pills or infusion or anything like that.
So the symptoms that you have, when did they come up? When did they start for you?
I would say, the symptoms were there for a long time, but, I went to doctors where doctors were like, well, it's stress. Well, it's anxiety. So here's a pill for anxiety. Here's a pill for depression. And I would say 4 years ago, I think it's when they were doing some lab work and they said it's Sjogren's syndrome, which is a type of lupus that a lot of people don't know about. It's not as known as lupus. So when I got that diagnosis, in a way, it was kind of like a relief. Like, okay, I'm not going crazy. I'm not a hypochondriac. There's something wrong with me. So in the beginning, it was a relief. But now it's like everything got worse. More symptoms, more fatigue. I mean, it got to the point where now on some days I was just not getting out of bed the whole day. No matter how much I slept, I was still tired. No energy. Even after, you want to do the energy drinks and you do the B12 shots and everything you can do to get yourself healthy, but it still wasn't enough. I was still feeling horrible. So that's when I said, no, we got to do something else. And that's when I talked to you about it.
When you started looking at BII, well, what did you find, or how did you even end up on that diagnosis on your own?
I think I want to say it was someone on Instagram that I saw. She talked about her journey and she talked about what she was going through. It's like if she was me. I was like, what? So then she's like, yeah, took out my implant. She has a high following, obviously, like maybe 1 million or 2 million people. So people were listening to her. People are reposting stories. People are talking about. So when she hashtagged BII, let me tell you, I clicked on it and it changed my life. I went into like this deep hole, of links and information and doctors and everything that I was feeling. I was like, this is me. Like, what? It just felt like I was supposed to find that page. I was supposed to find that link. I was supposed to click on that hashtag. And the more I looked into it, it was crazy, because that's exactly what I was going through that no doctor had ever mentioned to me. No one had ever mentioned to me.
So the thing with BII is, in the plastic surgery community, and I was telling Norma this earlier, on the physician side, on the plastic surgeon side, it's hard to be the one, there's
a stigma around
There's a stigma around, I don't even know how to explain it. Like, if you put implants in, you can't believe in BII.
Right.
And if you believe in BII, you better not be putting implants
exactly.
in. And you guys,
have to practice what you preach.
Yeah, practice what you preach. Kind of. But when you think about, these independent plastic surgeons who are in practice, breast augmentation is a big part.
Yeah.
And the breast implant companies are telling us that they're safe, and the FDA has their safety requirements, and they're like, as far as we know, this is what we know. So that's where we go into okay, what do we know and what don't we know?
Exactly.
And I'm telling y'all, with the plastic surgeons, it's almost like you either put them in or you don't. And most plastic surgeons are putting them in. There are a select few plastic surgeons who do nothing but implant removals, and they've built their kind of practices on this. Mm-hmm. And it leaves very little room for any other plastic surgeon, which now I know a few plastic surgeons who do take this stance of hey, we don't know, everybody doesn't get this.
It could be like an allergic reaction. Some people are fine with certain foods. Some are not. That's how I'm looking at it.
So that's how I feel too.
Everyone.
I don't think, because I have implants and I haven't had any, I haven't had any issues. And
I was fine the first few years.
And I know a lot of patients who have had implants for a very long time who have no symptoms.
Right.
But I've also known patients who get implants and start feeling sick right away.
Yep.
And I have heard of that. And we take them out and they feel better. Yeah. And I've also had patients come in just like you, which is when I called Norma that day, I told her, hey, this is what I've seen in the office. I've seen
firsthand
women like you who have come in and have very similar symptoms that, they say BII. When I talk to them for the first time, they're saying I have BII.
They already know.
So they come in and they have usually a list or two of medications that they're on,
Mm-hmm.
prescriptions that they take. I mean, procedures that they've had,
Right.
diagnoses that they've had, all types of stuff. And so by the time they've come to see us, they've already decided that, this is the best thing for them to do.
And that's what I did.
And we as the plastic surgeons, we want you to feel the best and the happiest. So if that means taking out your implants, then let's take them out. So I know on the plastic surgeon side, okay, if you start taking them out, how can you still be putting them in?
Right.
Which kind of gets doctors stuck. And I think that's what causes all of this stigma even more around it. Because if everybody could just be open and be like, hey, this is what I'm seeing. This is what I'm seeing. This is what I'm seeing.
We can only go by our own experiences.
Yeah, we can only go by our own experiences.
Mm-hmm. And for me, the best decision I made, and this was not an overnight thing. I think we should say me and you have been talking for months. I'm in California, you're in Texas, but I trusted, like I said, I really, there was not that many doctors that I even found in California. And the ones that were doing it for me personally, it was not affordable. Because how am I paying triple the amount that I'm paying to take them out than what I did to put them in? It didn't make sense. But, at the same time, I want to be safe.
Mm-hmm.
I wanted to be safe. I wanted to go, obviously have to be board certified and feel comfortable. So this is us talking about this for months. It just didn't happen overnight. And the more I thought about it, the more, I guess, anxious in a way I was too. I'm like, I want these things out now.
And that's how my patients would come. They would be ready. They're because other doctors, them out tomorrow.
Yeah. Other doctors were telling me January, February. I'm like, for me, sadly, that means I'm not going to feel better till then. Even with meds, even, you want to take the vitamins and drink water and whatever works for you. Nothing was working for me. And for me, doing those treatments, chemotherapy, no, it scared me kind of because they give you a big warning list. Kind of like, are you sure you want to do this? Because if you're feeling sick now. So for me, it was just not worth it. Why am I going through all this when I could just get them removed?
So here's the thing. Remember, you were telling me about an appointment that you went to that you mentioned it and that they were like, let's rule everything else out except that. Like they weren't ready to rule or to say, yeah, maybe you should get your implants out. It was like, let's make sure everything else.
Yeah. It's frustrating because only you know what you're feeling like. It's kind of like a roller coaster of emotions. Everyone's telling me different things. And these are doctors. These are experienced people. They know most of the time we trust the doctors and you have to. But for me, there was nothing else. I decided I want them out and I want them out now. And, me and you did our research. And after everything that we researched, I thought Dr. Hustak was the best fit for me. And I flew out here and here I am. But it came soon. Now I'm like, wow, okay, it's here now. This is what I've been anxiously waiting for. But now I'm like, it's tomorrow. Oh, crap. I'm getting nervous, but I know I'm in good hands.
You are in good hands.
Yes.
So what a procedure like this would entail is removing the implant. So there's even controversy on the way the implant is removed. Mm-hmm. So I know there is the embloc removal, right, and then there's capsulectomy, complete or partial. So it really depends on what stance your doctor has on as far as BII.
Correct.
So Dr. Hustak's stance, when you mentioned it to her, how about you tell us how your consultation went?
So I literally just got here yesterday and I went straight to her because it was an afternoon flight and I was really nervous. I'm sure the girls at the front desk could tell. But then when I started talking to her and, we talked about, at first I was thinking, I'm not an expert. All I did was send pictures and let her decide. So we were thinking implant removal, lift, and fat transfer. So with the fat transfer, that means liposuction, right? So you can get some good fat. And she asked me, so you don't want implants? Are you sure? I'm like, I'm positive. And like the thing I keep saying is I just don't want to look like a deflated balloon. Mm-hmm. At the end of the day, you still want to be a woman. Whatever makes you feel comfortable. For me, it was removing the implants, but still feeling comfortable, feeling like I'm still going to have cleavage. I'm still going to look good. But more importantly than look good, it's feel good. Mm-hmm. So I told her, ideally, I really don't care what size I am. Because right now I'm 36 triple D with the implants. In my dream world, full C, small D. That's totally fine. So actually, she told me I didn't even need the lift, which was good news for me because from what I understood, it was going to be like a sort of like a keyhole incision to where we lift from the nipple all the way up. That was scary for me because I'm like, oh my God, nipples, nerves, it's going to hurt. Oh my God, ouch. You're always scared of how it's going to hurt.
Yeah.
Nobody wants to be in pain.
Of the unknown.
Exactly. And I've never had a breast implant removal. So I was very scared, but she really put me at ease. And she said, you don't even need a lift. So I guess we're going under boob incision.
Through your fold.
Yes. And I'm sure it's going to hurt, but I don't think it'll be as painful as what I was originally thinking. She really made me feel comfortable. And after that, it was actually like a relief kind of thing. Like, okay, I can do this. I got this. So yeah, she was amazing. And everyone at her office.
And you mentioned to me that she told you they're going to send off a sample.
Yeah. From what I understood, she said, we remove everything. Like you said, I've seen on Instagram, online, like all the scar tissue that develops around the implant. So I guess that's normal over especially 13 years of having these implants. So we're going to remove them. And from what I understood, she told me to get a mammogram. I did all that. I did blood work, of course, everything to make sure I'm okay. Luckily, all my results were good. She told me that they will send a sample off because I believe they're doing, like we're just talking about, they're doing more and more studies on BII. It was kind of cool, like, wow, I get to be part of this. If I can help anyone out, it's totally worth it. Because if you think about it, I don't know about you, how many of your friends have breast implants?
A lot of them.
All of my friends have breast. Are you kidding me? In the early 2000s, that was like people that were turning 18, you got breast implants. You're 21, here's your boobs. Like all of my friends, I think butts are more a thing now. Yeah. Obviously.
Now it's here, you're 21, here's your booty.
Here's your booty. Yeah. But when I was growing up, it was boobs. Mostly all my friends, 80% have boobs. And I was just telling you too, that I have a friend going through similar, being diagnosed with an autoimmune disease, the fatigue. So if I can help her or anyone else out, that's why this is like my journal, that hopefully I can look back at and be like, wow, look at how much I'm crossing my fingers. Look at how I'm feeling now. I'm feeling amazing. It was that. And if it wasn't, it's okay. At least we're crossing everything out the list.
Yeah. And that's really how you have to look at it. Let's just
hope for the best.
Hope for the best. Okay, so let me tell you guys, I'm being very vague with what I'm saying about breast implant illness because I am not an expert on it. Like I have experience with seeing patients come in and have symptoms and will take their implants out and they'll say they feel better.
Yeah.
And I've seen it I've seen it many times. So I'm really, really excited for this procedure for you because I think it might hopefully relieve these symptoms.
It's crazy how I've heard some people even waking up post-surgery.
Yeah.
Literally, instead of being in pain, they're like, whoa, like it's like a new look on life. Like, the doctor told me it could take up to 3 months to see a difference. But then again, some people literally wake up from surgery and are like, I cannot believe this. So that's what I'm hoping for.
Okay. So when I was working with Dr. Andre, we did have a lot of BII patients who would come in to see us. And so the symptoms were very similar. Usually they're coming in with their husband or their spouse and they're going over like, this is all of these things that I'm feeling. Like, this is my last resort. I need to get these out. And they usually are just like you. I want them out. Like, get me in as soon as possible. Exactly. I will pay extra. Yes. I will just get me in and
finance, figure it out,
whatever. A lot of patients who have this situation, they don't want to go completely flat.
Right.
And a lot of them, since they probably got their implants when they were younger and have had some weight gain and weight loss, a lot of times they need a lift too. So we'll do a lift, implant removal, and sometimes a little bit of fat transfer. Sometimes they're just like, I'm ready to have nothing. I'm ready to be flat.
Right.
I've had a patient, she's like, make me as flat as possible. I'm done with breast. I'm good.
She just hated them.
She hated them. She was done with it. But we'll take them to surgery. And I mean, I can tell you, I've had patients say they wake up feeling different. They wake up feeling better.
I've seen the before and after. Some girl, it's like almost like a weird color in the whites of your eyes. And 1 month, but this is just what I've seen in general. Weight loss, like your hormones get better. You stop losing hair. That's been another thing of me. It's really traumatizing to start losing your hair. And I've seen the before and afters, and all I keep thinking is that could be me. That's going to be me. Mm-hmm. So I'm going in, I'm hoping for the best. There's no guarantee with anything, but it just motivated me. If it wasn't for the BII stories or talking to you about it, I wouldn't be here. I would still be like, well, that's just lupus. Well, it's arthritis. I got to live with it and take more and more pills every day. And I don't want to do that. I was looking for I needed a different way out. So I'm excited for tomorrow.
I'm excited for tomorrow too. So tomorrow we will have an expert talk to us. It's tomorrow for us, but it'll be in a couple seconds for y'all.
Exactly.
But tomorrow, Dr. Hustak can answer, some of these more important questions like, what is it? What do we think it is? Is it, are we curing it? What information do we even have on it? What's causing it? Right. So the stance that I've heard, from Dr. Andrew was, just like people have allergies to gluten, they have allergies to, pretty much anything. Like it is not a very far-fetched idea that women could have an allergic reaction to the material of the implants or something that has to do with the implant, or your body just doesn't like it, or something happens. Because a lot of women I've heard who have no symptoms, and then boom, it's like all of a sudden they start having symptoms like the chronic pain,
the fatigue, the anxiety, the depression. It's just a long list, like the one I showed you. It's a long list of things. So, yeah.
All right. I guess we'll find out tomorrow, you guys. We'll know more.
Stay tuned.
Stay tuned. Okay. So now we have an update. It's been, how many days post-op are you now?
I think this is day 4.
Day 4.
I was getting confused, but it's definitely day 4.
So day 4 post-op of the implant removal. And did you have a complete capsulectomy? I guess we'll ask Dr. Hustak. I'm interviewing her.
I believe so.
In just a little bit. Yeah.
Yeah.
Her portion will be along with all of this. So let's talk about the process. How did you feel morning of surgery?
So the morning of surgery, I was obviously nervous, very nervous, excited, which is weird. I've never, you kind of feel excited, but this one, it was like, we're going to start feeling better. I was just
anxious to feel better.
Anxious to feel better and literally speaking it into existence, trying to be positive about it. We are going to feel better. It's going to be good. But yeah, I was nervous. I told the girls as soon as they got me in there at the surgery center, give me something. I was like, fill me up.
Load me up
because I'm nervous, but excited. It's different. This time it was different because this time it was excitement mixed with nerves, mixed with anxiousness.
With hope. Mixed with hope.
Yes, definitely with hope, which each surgery is different. But for me, this one was even more different than the others, for sure.
You guys, and this is interesting because we're going to also talk about post-op care. So if y'all listen to the last episode, I go into the different post-op care styles. And y'all know I always say, don't go against your doctor's orders. I don't want y'all to go against your doctor's orders. But I do understand that just like with anything else, just like, for example, we were talking about it over lunch, was the vaccine. There's a lot of information for it. It's controversial. There's a lot of information for it, and there's a lot of information against it. And just because a doctor decides to give it doesn't make that doctor a villain, right? Because they're
or a hero.
Yeah. That's true.
Yes.
Or a hero. Okay. So how have you felt since surgery? Start from the smallest details to.
So obviously post-op, we're talking like the very first time I woke up. I don't remember much. Obviously I was still pretty drugged up. I remember getting into the car and being like, just get me home. Like I just want to lay down and start recovering. It was weird because I was like, I don't want to think about that. This is how I'm going to feel. I just wanted to like, just go and lay down and start my recovery process. So it's kind of a big blur. I'll be honest with you. The first day, not even the first few hours, but that first day post-op is a big blur. I don't remember much. I remember getting home and it was either my nephew or my sister that was like, give me something for pain now, like ASAP. And after I took the pain medication, I'd say within minutes, I was fast asleep till the next day. So that was good in a way, I guess.
Good recovering.
I was recovering and I slept a lot that first post-op day. So,
okay. And then
fast forward to the next day, I woke up definitely sore. I did have a post-op nurse come by on, I guess that was Thursday. She came by. Well, let me back up a little bit. Didn't have much of an appetite, but I knew how many medications I was going to be taking. So my sister was amazing, by the way. Thank you so much to her. She gave me my oatmeal and my gelatin and my liquids and all that good stuff to take with the pills because that's so important. But I told her, don't give me anything for pain. And she was kind of shocked in a way, like, you're literally like hours post-op. I said, no, I actually really want to feel this recovery process. Do you get what I'm saying?
I do.
I wanted to feel the pain. It's weird to say. For me, the pills make me very dizzy, nauseous. I rather have pain than being nauseous or dizzy for me.
Mm-hmm.
Like I told you earlier, everyone's experience is different. I told her, hold off on the pain pills. If I'm in excruciating pain where I feel like they're going to do more good than bad, then I'll ask you for one. She said, are you sure? Look at you. You're like, just went through a huge thing here. And I was like, it's okay. Let's hold off. So, I had my breakfast. I took my antibiotics, the nausea ones, the vitamins, the arnica, all that good stuff I did take, plus my regular meds that I usually take. I had my breakfast and I waited for my nurse. Nurse was amazing. She was a little bit late, but she was amazing. She came by and kind of told my sister step by step, look, this is since my sister was
taking care of you.
Taking care of me. You're going to remove this gauze and you're going to place this here and you're going to place there. And this is the ointment that you put on and with the Q-tip, like basically a step by step on how to, because there was a lot of bleeding.
It's a lot of fluid. Yeah, it's not really bleeding. It's
right.
Like blood tinged fluid.
Right, exactly. But when you're like post-op, you see it's blood, you think it's blood. So it's scary how much is coming out.
It is a lot. Yeah.
Yeah. So, and let me go back a little bit for those people that don't know, it was obviously explant surgery plus fat grafting.
To the breast.
Yeah. So we did both. No implant.
No implant.
And Dr. Hustak asked me, you sure you want to put it? And I said, absolutely not. I kind of, again, me had like this hatred towards these implants, like get them out and I never want to see them again and burn them or whatever you want to do. But that's what I did. I at the same time, you're a woman. You still want to have cleavage. You still want to look like a woman. So I said, ideal cup size? No ideal cup size. I just don't want to look like a deflated balloon. That's what I kept thinking. I'm going to look, these implants have been in there, 13 years? They're going to take them out and I'm going to be a deflated balloon. That's what I kept thinking of. I told her, it's more about how they look than the size they are. That's what I was concerned about.
And they look amazing, just so you know. They look so good.
Thanks.
Dr. Hustak did an amazing job.
I'm telling you, I'm going to see her tomorrow. I'm going to give her a big hug and I'm going to say thank you because already just 4 days out, this has been life-changing.
You guys, and let me tell y'all, I'm looking at her right now and there's a visible difference in the way her skin looks and the brightness in her eyes. And right now,
I told you about the hair.
Yeah.
I'm having
hair growth
4 days because I can see these tiny, tiny baby hairs. They were not there 4 days ago. I'm telling you, I just feel different.
And your hand,
my hand, look, Ma, no bandage. I told you that the pain was on my left from the rheumatoid arthritis. It was unbearable. I was taking the last week, maybe every single day, I was taking naproxen, something for the pain, something for the inflammation, some CBD cream and wrapping it up. And it was, I don't know if I mentioned it. I do have a special needs daughter that's 15. It was hard to even pick her up, which for me was very sad because obviously, I'm her main caregiver. Her dad helps me out a lot. Thank God he's in the picture. He's with her right now. But,
you're the main provider.
I'm the main provider and you need your hands. So it's just crazy how I'm like, I'm even touching, like, is this real? I don't have joint pain right now. It's just crazy for me how fast and again, I'm still very swollen. Yes, I'm still sore. I'm still recuperating. I'm not at 100%. I'm walking slow by all means. Absolutely. It was a major surgery. Yes.
But how do you feel that you're in your energy?
I told you earlier over lunch, I think I have too much energy, which is crazy because I have to tell myself right now, slow down. You're still post-op. Hold on. Cause I'm trying to maybe do too many things at once. And every day it's like to get out of bed, I needed a B12 and Celsius energy drink and Herbalife tea and so many things besides caffeine because of my gastritis that I was taking to wake up. And at night to go to sleep, it was crazy. Like I need something to wake up and I need something to go to sleep. It was just crazy.
And now you're feeling...
I feel so energetic. I could run a marathon. I'm not going to. I'm not. But it's just crazy how fast my energy levels are back. I haven't felt, to be honest with you, this energy I mean, maybe the last time I felt this energetic was when I actually was going to the gym a lot, and I didn't feel as sick. I had energy to go to the gym. 4 to 5 years minimum.
So, okay, you had your implants put in 2007, right?
2007, 2008. I don't remember the exact year, but yeah, it was about 13 years after I had my daughter.
Yeah. And your daughter's 15.
She's 15. Yeah.
So in that time, you didn't start having symptoms or anything like that immediately, did you?
Correct. I don't think it started slowly for me. So when you're starting to have symptoms and it's that slow, I don't think you put 2 and 2 together. So I would say, like I told you, the last 4 or 5 years, I think the lupus I was diagnosed with maybe, in that time frame, maybe 5 years ago. But then it was lupus. It was Sjogren's syndrome. It's literally the rheumatoid arthritis. That was months ago, less than 6 months ago.
When you got diagnosed?
When I got diagnosed, and now I started adding another medication to my list.
So on your medication list, and you guys, let me tell y'all, this is not uncommon. I've seen patients just like Norma come in with very similar symptoms, very similar fatigue, loss of appetite, hair loss, joint pain, those types of things.
Depression,
anxiety, low libido. Like they can't be intimate with their husbands because there's no desire at all. Like for me, it was even cooking.
I cooked. Now I have to go lay down for it. It was insane. And it wasn't just fatigue. I got to emphasize on this. Chronic fatigue for me at this point. Chronic. Where the days sometimes when my daughter was with her dad, I didn't get out of bed except to do what I absolutely have to do, eat or grab something to drink. Or it was chronic at this point. It started with fatigue, but at this point, years later, it was chronic fatigue and it was horrible. I'm an outgoing person. I'm energetic naturally. So for me, it was like, it's almost a guilt thing. Am I lazy? Am I, you start questioning everything and you're like, and then, people make comments. Oh, wow, hypochondriac. Oh, well, you're always sick. And I'm like, I'm sorry. I don't mean to be. That's just
I don't want to be.
I don't want to be. That's just really how I feel. So towards the end, I started not, I guess, talking about it as much.
I think I do remember you stopped kind of mentioning what you were going through.
Because it's almost like a stigma behind it.
There is.
And I didn't, like we talked about on the other episode, I told you my symptoms and it clicked for both of us. Wow, look at this. BII, what's that? And when I clicked on that link, it changed my life. And you told me too. You're like, hello, look at this.
Hello,
this
look
is
at
you.
BII. This is you right now.
I didn't know what BII was not even a year ago, I don't think.
No, you didn't know what BII was 3 months ago.
Exactly.
When did we start talking about this?
This is months.
This has only been months in the process. And when Norma came to me, she was telling me all her symptoms and we were having just a regular friend phone call.
Yeah, just friends catching up.
And then I called you 3 or 4 days later and I was like, hey, and you guys, even for me, think about this. I saw this in person. I would see this present in front of me and hear it, hear the symptoms and all of this. And even to me, it didn't immediately click. So it wasn't until 4 days later when I was like, oh, wait.
You put 2 and 2 together just like I did. I put 2 and
2 together. And that's when I called her and I told her, hey, maybe this. And she was just researching.
I finished your sentence. You're like, Norma, I'm like, breast implant illness.
Yeah.
We literally, because you told me about it, I think a few days ago. And then I started, and when you call me, I'm like, it's kind of it was weird. It
all clicked in.
Yes.
And let me tell you guys something that Norma and I were talking about, because Norma was telling me how hard it was for her to find a surgeon. Tell us about finding a surgeon in California, what the process was and what really led you to okay, I'm going to need to travel for this.
Yeah. So of course, you do your research. Me, I like doing my research. I Google this and whatever, talk to you. Thank God I had you because I had no idea what it was. Like I said, but I started BII doctors. Because I was thinking this has got to be a thing, right? There's so many doctors that are just you have I had my rheumatologist, I had my gastroenterologist, I had my, you have a doctor for everything, right? Mm-hmm. So I thought I'm going to Google BII and it's going to give me a long list of doctors. Well, no, that's when I was like, hold up. I think I found in my immediate area, at least in California is big on plastic surgery also, of course. So I was like, easy. I'm going to find one down the street that's going to be come on in. We're ready for you. And I found, I think 1 or 2. But when I called the office, it was going to be, a few hundred for a consult. And then I was talking to the girls at their offices, just give me an estimate. Just tell me around how much is this going to, and when they told me, I just about passed out.
How much did they tell you?
I heard, 13,000 for just the removal, just to get them out, period.
Mm-hmm.
I heard 15,000. I think in Beverly Hills, up to 20,000 for a removal and maybe a lift. That's it.
Mm-hmm.
So then I was like, dang, do I have to sell my car?
What am I going to have to do?
That's a lot of money for me.
What am I going to have to do for this?
What am I going to have to do? And I literally actually gathered the family together. Like, you guys, this is serious. Look, mom, dad, brother, this is what I think I have. And because they knew about
your other.
They knew about my symptoms. They knew about, I'm always feeling sick, with my immediate family. They saw it firsthand. So I told them, I'm going to need a lot of money. And I don't know about you guys. I didn't have $20,000 plus if I wanted to do something else. And I told them there's absolutely no way. And they, we came up with the plan. And I said, I have my friend, which is you. I said, she's working on it. She's going to find me. But it looks like this is going to be a crazy expensive thing to do. And, I remember my mom saying, well, it was only $3,000 to put them in 13 years ago. I'm like, well, yes, mom, but for whatever reason, and I didn't know at the time, it's going to cost a lot more to get them out. And there wasn't a lot to choose from.
Yeah. So on this point, you guys, and this is where you guys know, I'm telling y'all everything that I know. So as plastic surgeons, there's not a lot of information. Like, there's information, but there's not, like, how as a plastic surgeon do you put on your website, like, I will remove your implants. I also put implants in, because in the BII community, and there's absolutely no shade to the BII community. I have a lot of friends in there and I love them all. In the BII community, it's either like you put them in or you only take them out. Like, either you only put them in or you only take them out. But
because then it's like a contradiction. Warning, this is going to make you super sick, but here you go, I'll put them in.
So it's like, as a plastic surgeon, you have to pick a side, right? Either you go one way or you go the other. So it doesn't have to be like that, though. And these surgeons that are, and not knocking on those surgeons either, these surgeons who, their whole practice, like the only thing they do is implant removal. I do feel like they play on the heartstrings of the patients who are having these symptoms, and they're saying, like, only I know and only this way works. And,
you can't trust anyone else.
You can't trust anybody else.
There's no one else.
And there's, the surgery is going to cost $25,000. And,
I honestly would have paid it.
Because you were afraid.
I was afraid. And it was this time, it wasn't, like I've said a million times, it wasn't a cosmetic thing this time. Have I had cosmetic surgery? Of course. And I'm all for it. And I probably will still. This one for me was different because it was for health reasons. So for other ones, I know it sounds kind of crappy to say, I'll bargain around. I want my nose job. No, I don't want to pay that. I want this. But for this one, it was like, I want to see the best and I want to make sure it gets done right. And there's not a lot to compare to. So here, take my money.
Pretty much.
Kind of, honestly, that's
pretty
how
much.
I felt.
I know.
I have no choice but to give you my money because you're the only one that's saying you will do this for me and you will do it in the safest, most effective way.
Mm-hmm. And what I want you guys to know is that it's not just those guys doing it.
Mm-hmm.
All plastic surgeons can remove your implants.
They're just not talking about it.
They're just not talking about it because it's not, they can remove the implants, but they're not doing it the right way. No, yes, they are.
Yes,
they can. They can do it embloc. They can do a complete capsulectomy. They can do a partial capsule. Like, your board certified plastic surgeon can do this surgery.
Right.
So do not be afraid and pushed into believing that only specific surgeons in the country
do your research
can do it. Do your research.
Of course, like I said, for me, I had you, thank God, and I talked to you about it. When it comes to surgeons, I know a few good surgeons here and there.
Mm-hmm.
I know a few, but this one was different. And I was like, there's so much information. Who do I believe? And doctors are doctors, right? You're going to believe what they tell you. But I just felt for me, like I wasn't convinced, even though it was a doctor, even though, you know what I'm saying? So I was like, Mavi, look, girl, help me out. I am struggling. And I told you, I found this one. I was just, what was I doing? Honestly, the truth, I was just Googling doctors in my area.
Mm-hmm.
And by my area, I meant all of California, Orange County, all of LA County, Beverly Hills. There's a lot of plastic surgeons, but I don't know. I felt like it was weird. Like just something was missing. That's when I told you like, no, I'm going to need your help for this one.
Mm-hmm.
And usually I would just make my own decision. But this one, like I said, it was different. And it was very, very important to choose the right one. And even in Texas here, where I'm currently at now, where I got my surgery in Texas, I had a choice between two. Yeah. I literally narrowed it down to two.
Yeah, you guys don't. So whenever I tell y'all have your 3 consultations, don't think that whenever I send you to somebody, I'm only sending you to see one person.
Yeah.
I'm sending you to see multiple people because we need to find your match. And it's just like dating.
Mm-hmm.
You need to find your,
exactly.
You date around.
Be picky with your surgeons too.
Hello. Put your standards high. Keep your standards high.
Yes.
And so, one of the things that Norma mentioned to me that I didn't even know Dr. Hustak did was she was going to send once she removed your implant and the capsule, she was going to send a piece of the capsule to the lab
to be tested for BII.
Because they're studying it.
Mm-hmm.
So what I want y'all to know is, 1, I don't want y'all to be afraid of implants because it doesn't happen to everybody. And it's, we were talking about it over lunch and y'all are going to hear Dr. Hustak talk about it. It's not a far-fetched idea that people can have an allergic reaction to their implants. Like,
and we were talking about that just now.
People can have a reaction to peanuts. People have reactions to soy. People have gluten allergies. People have allergies to penicillin. Like, people have allergies
to everything.
So it's not impossible for people to have an allergic reaction
to a foreign object,
which is your implant.
Mm-hmm.
So there's still a lot of studies being done. There's still a lot of information that we're researching. There's still a lot of unknown, but let's work with what we do know. So for cases just like Norma, who was having these symptoms and last straw, rheumatoid arthritis, let me see if I can remove these implants and hopefully feel better. And 10 out of 10, what would you say? What would you say out of 1 out of 10? How do you feel now compared to 6 days ago?
Are you talking surgery or just
your symptoms?
I think right now I'm on, and I got to remind people, this is day 4. I would say I'm at an 8 when I should still be in excruciating pain. And again, I am sore. Yes, I'm walking slow. Yes, all that. But the energy levels, it's just insane. I'm not waking up I guess the best way to describe it is like feeling hungover even when you haven't drank anything.
Wow, really?
Yeah. Waking up, feeling dehydrated, feeling pain everywhere. Can you imagine waking up with pain from your head to toe almost every day? If you get one good day a week, you're lucky. It was that severe for me.
And it really, in the last 4 years, got to that point? Or would you say in the last year, in the last 6 months, how long have you been feeling like that?
Well, yeah, we were just talking about this a little while ago. The last 4 to 5 years were when I started getting diagnosed with, serious illnesses, for me at least.
4 to 5
and I don't know if I told you on the last podcast we did.
These are all going to be merged into one episode, so they're going to hear us in a minute.
Right. But here's another important thing I've forgot about. My rheumatologist the last time I went told me, hey, guess what? We might have to put you onto a chemotherapy pill to make you feel better.
Oh, yeah, that's right.
That's where boom. It was like a light bulb went off in my head. No. And I told him, hold up. Because doctor, if I told him, give me this pill now, I'm not getting any better. He would have given it to me then and there. He said, oh, it's not a big deal. It's just a pill you can take. We can inject it into you, the medication, or you can just take a chemo pill. But here's this form with the warnings on it.
The side effects. And it just about floored you.
Oh my gosh. I was like, no, well, hey, the side effects are kind of worse than what I'm feeling right now. I was like, no, sir. So I was like, okay, that's literally when I started thinking we have to do something. You know what I'm saying? That was like the straw that broke the camel's back, or however that saying goes. That for me was this is it. This is where it starts. I don't mind. I'm a person where if my head hurts, I'm okay with taking a Tylenol. My back hurts. Okay, I'll take something for whatever. But now we're talking about a medication given to me for cancer, for someone that does not have cancer. No, I want to feel better, but am I willing to take this chemotherapy pill? No. I said, hold off. Let's regroup and let's come back. I'm I think he gave me 3 months to come back. I think my appointment's next week actually, which is weird. But I said, no, I'm going to hold off on the chemo pill. So he upped my other pills. He gave me the rheumatoid arthritis pill. I said, I'm still, I was literally like, I'm chronically fatigued. And I don't know if you saw, I was getting B12 injections. It's not like, I was eating like, like the worst of the worst. I was having B12 injections. And the last time I had an hydrotherapy injection I was desperate. I paid like $150 on Groupon because that was like a $500 injection. I was desperate to feel better, except I was not willing to take the chemotherapy pill quite yet. That's where I drew the line.
How in the past 5 years because you guys, I've known Norma for a very long time and she's always stayed slim. She's stayed in pretty good shape. Mm-hmm. And this time that I saw her, that I hadn't seen her in 3 years? Bloated. You could see it in her face. And I'm telling y'all right now, I'm looking at her and the bloat around her face is going down.
Bloat where? Sorry, guys, I'm being silly because I'm on my live too. And I actually have a lot of my girls on here on my live.
Do they have questions?
They have questions. Shall we answer some? If you guys have any questions, my friends, breast implants, or if you know someone that's having side effects from their breast implants that might not have an amazing friend like I do right here, send me your questions right now on the live and we'll be answering questions for you guys. Oh, here we go. I think there's a button you press for questions. Something. Sorry, I'm not that good at this. Anyways, I'll be reading here on my live. We have a few people on here that are gonna send me their questions because, like I said, and this is true. If I didn't have you, I would have I'm just sick. What are you gonna do about it? I'll just take a chemo pill. Well, I'll just do infusion treatment, which is another treatment for people with lupus. And it's weird because every time I went to my doctor, I'm like, I don't want to go to that little room. There was a little side room where all the severe lupus patients were having the infusion treatments, which is a form of chemotherapy, by the way.
Wow.
So I told my doctor, this time, are you sending me to the little room? I was always talking about, no, I don't want to go into the little room because that means you're really sick. Thank God. I'm glad I didn't resort to that.
You didn't have to.
I didn't have to because I said, and again, we don't know if this is going to work 100%. I'm just 4 days post-op, but I'm feeling very positive. I think we got it. I think, and I hope so.
I hope so.
Hallelujah. Yeah. Even like you were saying, my face, I just feel different. I look different. It's
the swelling in her face has gone down.
Like my face looks slimmer already. It's just crazy.
Let's take a before and after because I'm serious. Yes. I see it in your face. But what I want to kind of mention is that for example, for those girls who are on the fence about getting implants or they were going to get them or they're thinking about getting them or they have them. So whenever I put my implants in, I already knew about BII and I consciously knew and I made the decision. If I start having any type of symptoms, these implants are coming out. Yeah. And my reasoning was, I don't think I'm going to have a reaction to them, but you never know. And if I do, I already know, quick procedure, take them out. That's it. They're done. Right. And I don't have to worry about it.
And we talked about that over lunch as well. Hey, you know what? People are asking me, whoa, hold on. I was just going to get my implants. Or, whoa, should I not? Oh my God, am I going to feel sick like you? It's like anything else. It's going to depend on your body. Some people have an allergic reaction to shrimp. Some people can't eat peanut butter. Some people, it's literally, for me, I'm not an expert, but for me, that's how I've been thinking about it. And because not everyone has a reaction from the implants.
Because I've personally met hundreds of patients that have had their implants in for 20 plus years.
Wow.
Like they got implants in the 90s and they have no issues. I'm meeting them because we're switching from saline to silicone, or maybe they're switching from a smaller.
Or some people are just switching them out just because it's been 10 years.
Yeah, which is what I thought. It's time to switch them out. Maybe they want something smaller. Maybe they want something bigger. So, I've met a lot of women who have had implants that have absolutely no issues, no problems. Exactly. So I consciously made the decision to put them in.
But you were aware of what could happen.
I knew. I already kind of have that, like, if I start to feel any type of symptoms, like I'm not going to mess around and try to figure it out if it's something else. Right. Like my first instinct is going to be, I got to take my implants out.
And it's crazy because also going back to when I first got my implants, we're talking, I'm old, y'all. Without telling you my age, I'm going to tell you my age. Early 2000s. All of my friends had implants. I would say 80% or more. So nobody, oh my God, are you sure that you might get BI? Unheard of. It was like, I don't know, like, getting Botox, getting like filler. It was just
normal.
It was normal. All my friends had implants. And the thing is, I did have a lot. So I don't know if that had to do with the BI, but looking back at it, the most painful procedure I've ever had. I went from an A cup to a C, from a C, obviously, to a triple D, where I was at now last week. Well, when I had my surgery, so much pain. So I'm wondering now, could it be that the moment I put them in, my body was like, hold up.
Could it be?
I mean, I felt a little sick. Not any real symptoms, just very painful. And it wasn't even my boobs. It was my back. I think I was used to having no weight because I was an A cup. So now you have these huge melons in front of you. So it's heavy. But breast implant illness was never a worry of mine. I was just worried about how much is it going to hurt? That was the only worry. How are we going to do post-op? How much is it going to hurt? Because my friends all said, implants, you're good. We all have them. Look at us.
We're fine. We did fine.
I think like 3 or 4 days, some of my friends were already out and about, which is insane.
Which is not uncommon.
No, it's not uncommon. They healed fast. They did amazing.
But for you, was your recovery harder?
My recovery was harder, but I wasn't showing the symptoms I was up until the last 4 or 5 years. So yeah, I was maybe like a week where I didn't really go anywhere. But like I said, the real stuff began after the 10-year mark of me having them.
After the
10-year mark.
So I don't know if y'all have read any of the data on the implants, or it's kind of like this common, out there from the implant companies that there's a 10-year, they want you to switch them out every 10 years. And the common kind of response from plastic surgeons is if there's not anything happening with your implant, for example, if there's nothing wrong with them, if they're not hard, if they're not bothering you, if that you're okay with the size, if you still, if they still fit your aesthetic, leave them alone, because it's better to leave them in and then take them out if you're not really having symptoms. If you're not really having symptoms, then you don't really need to.
Right. Yeah. And I actually did call my doctor. I forgot to mention that. I want to say the last year or two, I spoke to someone at his office and I said, hey, it's been 10 years or so. Do I need them out? And that's the same thing they told me. Well, are they said, are my actual implants causing me problems? Well, no, it doesn't hurt there. Not necessarily there,
Well, because that's the common...
Is it ruptured? No, well, I don't think so. I didn't know.
Well, because those are the common, whenever I'm perfect example, if somebody called me and I was coordinating and they're telling me, should I switch my implants out? That's exactly what I would ask them. Are they causing you any issues? Because that's kind of like that response you get from your surgeon. We're not going to take you under general anesthesia.
If it ain't broke, don't fix it.
Exactly. If it ain't broke, don't fix it. So we're not going to take you under anesthesia and do a surgery that is
major surgery,
unnecessary.
Right.
But for you didn't really feel any symptoms. So I don't know.
Exactly on my breast area.
I'm really, excited to hear what Dr. Hustak has to say on what we've learned. What do we know?
Exactly.
Because as a plastic surgeon, like we were talking earlier, either you put them in or you take them out. And the thing is, a lot of surgeons, you can't exclude, putting implants in, because not everybody not everybody is feeling this. And this doesn't happen to everybody.
And another question I had for you, staying on that topic. Have you seen where people switch them out and then they feel amazing? I mean, not like me. I took them out completely. So I have no more implant in right now. I did a fat transfer. Some people just switch out. I mean, is it always for like look reasons, or do they feel better after switching out the old implants?
Usually if I saw somebody with BII, we're removing the implants. So we're removing the implants. We're doing a lift. We're doing a little fat transfer. That's about it. Yeah. And what's so, now putting it together with how I'm seeing you and how I've known you. So I know I know this. I've seen patients just like you come in for their first post-op appointment and be like, oh my God, the brain fog is gone.
Oh my God, the brain fog.
I can think again.
Yes.
Tell me about the brain fog.
Well, mommy brain. It's just mommy brain. I'm just busy. But it was becoming to the point where I was like, this is not okay. Somebody just told me something and I'm needing to write it down on my note. And we're not talking like a big thing. It's like simple things, and and maybe, I don't know, as small as sending a form to my daughters when they literally wrote it on the book and everything. And I have it on my calendar and I still forgot. Oops, mommy brain. But I'm like, dang, how bad is this mommy brain supposed to be? Because the fog was pretty intense.
See, and you know what? Until I brought up brain fog, you hadn't even mentioned it.
No, but that's another symptom I had. It's a lot. And I posted the symptoms. I think I'm going to create a highlight actually on my Instagram story because so many people have had questions and I'm sending them to you, but I think I need to do a highlight on the symptoms.
Like, I'm going to bring up this list and then let's go through it and tell me which ones you had and which ones you've had and have resolved. Anxiety?
Right now, it's non-existent right now. And I was on Xanax for many years. My doctor actually told me no more because they thought I was getting addicted to them. Mind you, I was on a very low dose.
I do remember you were on like
yes,
0.25.
0.5, very low, but very addicting pill. So I was like, I need my Xanax. I'm like, wait, why am I taking my Xanax right when I wake up if I'm not even, it was almost like just reacting. I need to take it right now. I need my pills. And the doctor said no more.
We already know fatigue.
Yes. Chronic for me. Big symptom.
Joint pain.
Everywhere. Yes.
Muscle pain.
Yes.
Insomnia.
Yes.
Brain fog.
Yes.
Difficulty concentrating.
Yes.
Memory loss.
Yes.
Limb numbness or tingling.
On my hands upon waking up every single day, I had to wait a few minutes for the tingliness to go away.
Wow. You don't, relieved?
I haven't had any since post-surgery. I don't know if it's going to come back or not, but I haven't had any in 4 days.
Let's do a follow-up interview in like 3 months.
Yes.
Okay. Vertigo?
Like everything's spinning around me. Yes, ma'am. Not every day, but I did have it.
Fever and chills?
No, not necessarily fever, but chills at times.
Muscle weakness?
Yes.
Temperature intolerance? Like you couldn't tolerate too hot, too cold?
I would say more like I was cold and all of a sudden the hot flashes.
Oh, hot flashes. Sensitivity to light or sound?
No, not that one.
Difficulty swallowing?
Yes. Very dry mouth. Extreme dry mouth.
Well, hair loss?
Hello. I was just telling you, I've been losing even my sister said when I got here, the first day I was here, whoa, you lose a lot of hair. And I'm telling you all this brand new baby hair. It's like almost to my eyebrow. That's all new hair. So yes, hair loss. Yes.
Dry skin?
Very dry.
Slow healing?
Not that one. No.
I don't think slow healing is probably like from cuts and wounds. Like
I wasn't really cutting myself.
Skin rashes, lesions.
Many rashes. Didn't I tell you when I got here, I still had a rash from I said maybe it was shrimp.
Yeah. Rashes. Ringing in the ears.
Oh, wait. I had 2 syncope episodes that I didn't tell you about. It's kind of like when you pass out and you lose consciousness 3-4 years ago. So I did have 2 syncope episodes where they took away my driver's license.
What?
Yeah. Sorry, we didn't talk about that. See? Thank God for that list. I had 2 syncope episodes where I passed out, turned purple. Paramedics had to come in.
What the heck?
Kind of give me some.
Tell me. I didn't know about that.
Remember, I wasn't really telling people about. I had so many symptoms. I thought I was going crazy, and people might think I'm a hypochondriac. So I just kept it to myself. But yeah.
Wow. Okay. Headaches.
Yes.
Depression.
Yes. I'm still on Zoloft, but I'm not feeling depressed. But so I have to go see all my doctors and be like, "Hey, I don't need this anymore." Yes.
Decreased libido.
Yes.
Mood swings.
Oh, yeah.
Sharp pain in your breast. Did you ever feel any sharp pain?
And it's funny because my breasts were fine, but everything else was messed up.
Food intolerance?
So much food intolerance. I just had a surgery in February that removed part of my intestine.
What?
I mean, the doctor, my gastroenterologist, my gastro I've seen for many, many years, even before all this. I've always had gastro issues. So who knows? That one's up in the air. It turns out that when my mom gave birth to me, a part of the umbilical cord stayed on my small intestine. It kind of fused together.
What?
So in February when I had surgery, they removed that. And I have been feeling better as regards to the food tolerance. But still, the
weight gain?
A lot.
Yeah, you guys.
The last few years.
And I think she's I wonder how much you've lost since you got here because I can see it in your face.
Yeah. And I told you the weight gain was horrible for me.
Autoimmune symptoms or diagnosis.
Lupus, Sjogren's syndrome, rheumatoid arthritis, to name a couple.
Fibromyalgia symptoms.
I don't think so.
Inflammation, heart palpitations, irritable bowel syndrome, shortness of breath, night sweats.
All of them. I was seeing a cardiologist at one point.
This is insane.
Insane. Yeah, I'm telling you. I think my cardiologist I was on a monitor for 24 hours to make sure my heart was working. And at the end, I was diagnosed with a mild heart murmur.
And you're like, heart murmur?
Yeah. I mean, for me, it was they kind of talked it down to, well, it's normal. A lot of people have heart murmurs, but I'm like, I'm literally, I don't know if you guys watch Friends. It was like a Friends episode. Hello, I'm having a heart attack. Hello. It was scary. It was very scary to see a cardiologist. I was on beta blockers for a while.
Mm-hmm. Wow.
Mm-hmm.
Norma.
Yes.
It's crazy how.
That's just to name a few.
And this, you guys, when we were talking and she was telling me all of these symptoms, it took me a minute to really put it together.
Put 2 and 2 together because there's just so many. Yeah. It was just insane. It was a lot. And you've seen all my medications that I was taking. That's me coming off of a few of them because I literally had to be like, it's too much. We need to come off some of them because it's just too much medication. It was a lot.
How many medications were you taking a day?
Up to maybe at some point 7, twice a day, some 3 times a day. A lot. More than my daughter who has, at this point, I was taking more than my daughter who has epilepsy, developmental. She has a lot. My daughter's wheelchair bound. So at this point, my daughter was doing way better, which is fine by me. I was taking more medications than her. That's how bad it was.
If you really think about it, to have all of these issues while you need to be at 100% because your daughter requires your help. There is no, I'm tired, I can't do anything.
No,
I have to get up. No.
Bathing her the last few months was I had to call my 65-year-old mother to come help me because she had more strength than me. I was like, Mom, I swear to you, Mom, I just cannot. She's too heavy. And my daughter, mind you, by the way, is tiny for a 15-year-old. She's only about 55 pounds. So I was like, some things, that was a big thing for me too. My daughter's not going to stop growing. We want her healthy. We want her to gain weight actually. So what's going to happen when she keeps gaining weight and she's bigger and bigger and can't barely lift her up? So for me, that was huge. I have to get healthy for my daughter, period.
Mm-hmm.
And I even told you, I felt so guilty. The mommy and me dates had stopped because mommy's too tired. I wasn't taking my daughter for walks because mommy can't. Mommy's tired again. And it was a guilt thing for me. It wasn't even I wasn't telling myself, be easy on yourself. You're sick. I was like, I'm just a lazy person. That's what I thought.
You were convincing yourself.
I was convincing myself that I was just being lazy. Well, you don't go to the gym. You're not drinking enough protein shakes and kale smoothies, whatever the heck you want to call it. But I knew that I was living a better lifestyle than a lot of people that I know that are doing way better than me. So
you eat pretty healthy.
I mean, for the most part.
You're not eating junk food every day.
I'm not going to the drive-thru and having 6 Big Mac. No. Because another thing, my food intolerance. So I do a lot of home cooking, For me, anything you cook at home is better than anything you can buy out at a restaurant. But still, having my protein shakes, I'm having this salad's going to make me feel so good. Well, this salad just gave me food poisoning. It was crazy. I just could not figure it out. And here we are.
So here we are. Post-op day 5. 4.
Yeah.
Feeling
crazy energized. Yeah. It's just my number one. If you have to choose one symptom, that was the worst. The chronic fatigue. I mean, girl, I could stay in bed all day if I could. I couldn't because I had too many things to do as a person that's trying to run 2 businesses, as a full-time mom to a special needs kids, cooking, cleaning, it's never ending. Moms cannot get a break. We're not allowed to be sick like that because there's too much to do.
There's too much to do.
So I was just telling myself, you don't have time to be sick. Get up and do it. Oh, well, too bad. You don't feel good. It's still got to be done. Mm-hmm.
Well, so now we know the change in Norma's life. I mean, let's see how she's doing in 3 months. But if she's improved this much in 5 days, 4 days, I keep saying that, in 4 days, I mean, what's to come? I'm super excited.
I'm excited for the future.
And this is the so common. Women who are like, I do want to get my implants out. I am thinking about it, but maybe, I don't want to be flat. I don't want to be flat chested.
That was a concern of mine.
Yeah. So, and you're not alone. There's a lot of women just like you having the same questions. They're still having the same, what if it's not even my implants? What if it's something else? And like I told y'all, whenever I put my implants in and my immediate or what I thought is I'm not going to try to figure out and see if it's something else. I'm going to take my implants out first.
Right.
And then see maybe it's something else if I'm feeling. But another thing that I noticed in these patients that I would see for BII is that they're almost around the same age.
Mm-hmm.
Like it's 40s.
Mm-hmm. People that have had them for maybe longer.
No, but I've also seen patients who have just put them in and they start having symptoms
right
immediately. And like I've had a patient who had them in for a year and she started having all of these symptoms and we took them out and she felt back to normal.
And did you know what was in your breast? I'm sure you did because you're educated in the field. I just literally weeks ago saw the ingredients on what's that. There was an FDA warning or something that came about. They're labeling they're putting on the implants now.
Yeah.
An FDA warning.
Yeah.
It's like when you buy a pack of cigarettes, warning, this could cause cancer, like warning. I don't know exactly what it says, but something to the effects of like, you're going to put your implant, this could make you very sick. And I read the ingredients and I was like, I had no idea.
Let's ask Dr. Hustak. Let's ask Dr. Hustak to go into detail with us about the new FDA warning.
Yes. And I'm going to see her tomorrow. Life changer.
For your post-op.
Post-op. And then I was thinking about being here 2 weeks or more I'm ready to go home Tuesday. It's a wrap. I love y'all in Texas, but I'm ready to get back to my life, to my daughter, to work. I'm excited to go back to work. I'm anxious and that's weird because usually I would be like, ugh, but no, I told her,
I'm ready. My brain is working.
My brain is working. I want to,
You're like, I have ideas.
I have goals to meet. Yes. And if she allows me to, I'm ready to go home Tuesday, which is much sooner than expected.
I'm excited for you.
I'm excited. Big shout out to Dr. Hustak, by the way.
Dr. Hustak, she's amazing.
Amazing.
Y'all heard her in the Mommy Makeover talk. And what I love about having these plastic surgeons on is that we can always be open.
Right.
We're open about what we know.
No shame.
There's no shame in just saying it might not work with your physiology. It might just not work for you.
Right.
And that's okay.
To each its own.
To everybody their own. I'm telling you, and I keep comparing it kind of to the vaccine. It's like with the vaccine, the doctors who do it, who push the vaccine, and then there's the doctors who don't push it. Tell us, for example, how your neurologist?
So yeah, obviously I told you my daughter has epilepsy. She sees a neurologist. We go in my area, which is Orange County. I wasn't really content, I guess, with her neurologist. I really shopped around. I was lucky enough to work at a pharmaceutical company for a while. So I got referred to a top neurologist at UCLA, which they're world renowned, by the way, Dr. Rosh. I got mine as soon as I could since I'm a healthcare worker because I was caring for my daughter, obviously, during COVID, during all of this. I got it as soon as I could because for me, the good outweighed the bad for me. I was high risk, lupus, Sjogren's autoimmune disease. My daughter was, high risk as well, having my mom's over the age of 65. My dad is in his 70s. I just didn't want to risk it. And for me, it was worth it. But when it came time for my daughter to get it, when she was able to, I was able to get it way before her. When it came down to her, it wasn't like, okay, let's take, no. And a lot of people don't know that because I guess now it's become a politics thing. So I don't really like to talk about it a whole lot, but I did my research a lot because when it came to her, I wasn't sure. Yeah, it's a new vaccine. Yeah. I was like, well, who are you going to call? Well, your doctor. They're going to be the ones that know the most, right? I called her neurologist and he said, listen, you do what's best for you and your daughter. I did not study the vaccine. I'm not a COVID doctor. I'm her neurologist. Can I tell you what I've seen so far on the patients that have gotten it? I haven't seen any serious side effects, but I don't know if that's going to be the case for your daughter. He really was amazing about it. He didn't push it. He didn't say she has to get it now. None of that. He said, talk to her pediatrician. So again, I called her pediatrician and it was kind of, they were both like pediatricians said, I don't know how it affects kids with epilepsy because I'm not a neurologist. So I was like, well, thanks. But they were honest with me. And I appreciate the honest more than pushing something on me.
And that's exactly how I feel. Honesty. I want the honesty. Let me make the decision.
Exactly.
Or for example, and Norma and I were talking about this just earlier today about the post-op care because okay, y'all heard in the last episode where I'm telling you, I don't want you to do anything against your doctor's orders, but this is what other people are doing. So Norma, knowing she's already gone through this liposuction recovery once.
Right. I had a BBL 4 years ago.
So tell us about the difference in your recovery then to the difference in the recovery now and what you did different and why you chose to do it differently.
I feel like BBLs, even in the last 2 years, have become huge.
Post-op recovery.
4 years ago, I had no idea about lymphatic massages and post-op massage. Nobody ever told me about that. I never knew till not too late, but I had already healed in a way.
Mm-hmm.
So I never got my massages. My doctor never mentioned. He kind of said here in California, it was a doctor in California. He kind of said, here's your post-op garment. And when I saw him post-op, he said, put this board on your garment and see you later. That's it.
So
no post-op care.
How long did you stay firm after that surgery? Because one of the things that in the Colombian style post-op recovery that I've been talking to you guys about is that they say, or at least I don't think I've talked to you guys about my very good friend Yolima, who she is amazing. She's amazing. A 25-year vet,
which is unheard of. Most people are, I feel like.
Yeah, but it's because she learned everything and she studied in Colombia.
In Colombia.
So she knows it. She lived and was immersed in that culture.
Right.
Like that post-op. She worked with some amazing plastic surgeons over there.
Yes. And a lot of people still go there.
Yeah, a lot of people go there. So what Yolima tells me is the longer the fluid stays in, the longer that person is going to stay with that really firm, and she says maybe could be what's causing some of that fibrosis.
Oh, yeah.
So
I believe it now.
How long do you think you stayed hard after your first surgery?
I'm going to be honest with you. The board was uncomfortable. And my doctor, I don't remember him being really strict on it. He was just kind of here you go. You can wear this if you want. Oh, here's yeah, sure. Get a post-op. Nothing was this is imperative. And I'm realizing that now that your post-op care is just as important as your surgery.
Mm-hmm.
Big time. At that time, of course, I told you I was maybe 20 to 30 pounds lighter. I started working out sooner, maybe. So luckily I did stay, with the small waist but these last 2 years that I gained all that weight, it's weird now because then I saw this side, cellulite, so much. I've never had cellulite in my life. And I'm like, whoa, even years later, you can see the side effects of not taking care of your post-op body. I didn't really do anything post-op, really. And now I've gotten 2 massages already with Yolima, who is amazing.
So, and Yolima, you guys, she's amazing. She only speaks Spanish, you guys. And y'all know on the show, I always like to highlight women who have, created a business from, their post-op journey or from their, from plastic surgery. So Yolima has a spa where all she does is post-op lymphatic drainage massage.
Right.
She only speaks Spanish. So, and she's shy. Trust me, I'm trying to convince her to come do an episode with me. And she's shy. She's like, just come, visit me and you can record me while I talk.
Aww.
And so I have some voice memos that hopefully I can put together, with an episode. But this time, so the doctor order from Dr. Hustek was what?
I believe she said, don't get any post-op till a week or 2 later. Don't let anyone touch
no massages.
No massages, nothing.
For a week.
Right. I got 2. one 2 days later. And I just had my second one yesterday.
So Norma went against doctor's orders and had a manual lymphatic drainage massage, which is that massage where they push all the liquid towards the hole, the opening.
You see that? Yeah, that stuff was just...
How did you feel? Tell me how you felt. Because, okay, so what I've been seeing, and oh my God, you guys, I've watched these videos and there's women screaming during the massage. So let me tell y'all, this massage should not hurt. If it's hurting, it's not being done right.
Right.
So tell me about your experience during that massage, post-op day 2.
First of all, I told her, it's just going to hurt. She assured me. I mean, I could barely walk. This is day 2.
Yeah.
Was I in a whole lot of pain? No, but I was very, very sore, very bruised. I was worried about the pain because I have seen these videos and I have seen the blood gushing out from these small incisions. And, I get a little woozy, just like anyone else, seeing any kind of fluid coming out of me. I was scared. I was scared. So she said, this is not going to hurt. The best way I can describe it, it's it hurts, but it feels good.
Like a pleasurable pain.
Yes.
Relief.
Yes. Yes. And I don't, as of now, I do not regret getting those massages. I tried to get one today, but I had no time, but she was amazing. And now, remember, I was telling you, I was like, wait, if I didn't go to her, I am very swollen still. I told you, can you imagine all that stuff would still be inside of me?
Mm-hmm.
All that fluid.
All that fluid would still be
There's
in there.
no way it would have came out on itself. There's no way.
So, okay. When fluid is underneath the skin and it doesn't get pushed out manually and those holes close, what happens is your body reabsorbs it. And so it's supposed to. Your body is supposed to reabsorb the liquid and, it'll come out in your urine. That is the way, like we're told, the natural way. You don't need the massages because your body is going to dispose of the fluid anyway.
Right. And for me, post-op care this time around was huge because I don't know if I told you, I have been getting, even before my surgery, just, when you're feeling extra bloated, those lymphatic massages. And even then, I hadn't had surgery or anything. I could see the difference.
You could see the difference in the massages? I mean, in your abdomen after the massage?
Oh, yeah. And this is months ago I had done them. A lot of, and again, it could be, I'm fairly positive it was part of the BII stuff. Very bloated, very, always just feeling full and looking full. So I already have my post-op in California scheduled. I am starting with 10 for me. Like I said, again, this is what I'm doing.
Personal choice.
I'm not saying this is what anybody told me. I'm choosing to get, I think, at least 10 to begin with post-op massages. But I think that the post-op recovery is so important. You just have to do it, along with, of course, what you eat, what your exercise, 1 second exercise, all that plays a part into it. Because people assume, oh, you're having lipo. That's why you look the way you do. And I'm like, no, because you can gain all that back and look good for me. I already had one BBL and I gained all that rep and then some. So for me, it's going to be like a lot of women. Yes, they have had surgery, but look at their routine.
Mm-hmm.
It's maintenance. If you don't maintain it, unless you're like a freak of nature or you're just lucky, you're not going to keep your shape.
No. And I think I talked about this in the last episode about how I noticed a difference in my shape when I stopped wearing my faja regularly.
Oh, yeah. My faja is going to stay on until I can't no more.
Stage 2, get you a stage 2 or a stage 3 that fits you comfortably. Send it to the faja doctor. Get it altered to your measurements. Mm-hmm. And then routine use. I'm going back. It's getting cold. Y'all know I'm all about, it's BBL season because you can wear your faja and you're not hot.
Right.
Because I am so hot natured. Like I can't deal with it. I get too hot. Like I start
It makes me mad when I'm too hot. I mean, my makeup, my hair. Yeah.
Me too. I think I'm just like, I can't tolerate it. It puts me in a bad mood. So BBL season for me is when you can put your faja on and put your clothes on and you're not hot.
You're just,
and you know why I say it's BBL season? Because the higher compliance level during the winter.
So I did it in right timing for me.
Yeah. Because you're going to be wearing your faja during the winter.
Yes.
At least for the next 6 months.
Oh, yeah. Mandatory. Mm-hmm.
So what did Yolima tell you when she sent you on your way and she's like, okay, you're going to go home. This is what I want you to do. Yeah,
I told her, I'm like, I already have my massages scheduled. And, like I showed you earlier, under my arms, I did have a lot of fat. So like you said, doctor went to work on there. Mm-hmm. And that's very, very sore area. And I'm still very swollen there. Obviously, the breast area, we're not going to touch because we put the fat grafting in there. But she told me to make sure I tell my massage girl, to put heat on there. Mm-hmm. Heat, massage to help with this inflammation because it's pre-inflamed. It's very bruised right there. And I added Yolima for sure. I'm going to be telling my girl to follow her because she's a veteran.
She's a vet.
She's amazing.
I love Yolima.
I told her I wish I could take you home because I need you to do this for me every day. But I have someone really good back home. So we will figure it out. And I'm going to take Yolima's advice, of course.
So in conclusion, worth it? Would you do it again?
Yes. For health reasons. Yes.
Y'all can hear the mic moving around because she has to get up and stand.
I have to get up every so often.
She has to get up and stand. She can't be sitting on her butt.
Sorry, guys.
She just needs to stretch.
Around.
But you believe that your symptoms are relieved.
Mm-hmm. Yes. It's like literally like a weight taken out of me. And I mean, to top it off, my boobs look amazing. But I did tell the doctor this was for health, and it was. Would I do it again? And any cosmetic procedures that are extreme like this, I think I'm done for now.
Yeah.
I took my implants and that's what I wanted. I'm okay with the Botox, the fillers, yes, but I'm done for now with the plastic surgery. I don't regret it one bit at all.
Good.
And most people, the first few days are like, oh my God, I hate it. I wish I never did it. I feel horrible. For me, it's the opposite. It's like, I have too much energy. Okay, what's next for me? My life. It's like my life is starting all over again in a sense.
Wow.
Yes. It's like a new beginning.
It's like a new beginning.
Yeah.
Well, let's start from now until 3 months. We'll bring you back on in 3 months and do like a catch up and see if any of the other symptoms or what happens once you go back home and you talk to your doctors and see what's going on with your meds. I wonder if the next time we talk to you, you're going to be off all your meds.
And that's a goal of mine. Besides the Explant, which is a medication for gastritis. Like I said, this is from when I was 10, 12 years old. My intention is to come off all of them, by the way. Every single one of them, because of the side effects, because of the long-term effects. One of the one I take for lupus, the hydroxychloroquine, which people are taking for COVID, but that's a whole nother story. The hydroxychloroquine could potentially leave you blind after. So I see an eye doctor every year or twice a year because that's the side effects of it. So yes, my intentions are to see every single one of those doctors and tell them, obviously I want their input, but I'm going to say, if I'm going to be honest with them. If I'm feeling better, I want off besides the Explant for my stomach. Mm-hmm. My ultimate goal is to come off all the meds.
I hope so.
Me too.
And you know what? Let me tell you that I have seen patients who have had their implants removed and feel no relief.
Right. That's why I'm saying I'm hopeful. I don't know what's going to happen.
No, immediately, right away. Right away, they're like, I feel the same.
Like the doctor said, some people up to 3 months to see real how they feel.
Yeah. So. And they'll say something like, I've had a patient remove their implants and then come back and
get them in?
Put them back in because she was like, it wasn't that. It was something else.
Oh, no, dear Lord, no. For me, 99.999% that the implants will never come back in.
Because you felt immediate relief.
But like I said, I'm not trying to get ahead of myself. I'm just being hopeful. I don't know how I'm going to, like you said, when we talk in 3 months, I don't know, but I'm hopeful. And this is the truth of how I'm feeling now.
Yeah. And that's what I want you guys to like with this podcast. And I talk to you guys about, lifting the stigma, lifting up the veil, demystifying things. Like this is part of that demystification. Like
and the judgment of others.
And the judgment. Like
I had judgment from my own mom. I don't know if I told you. My mom said, well, if they were going to make you so sick, why'd you put them in then?
Mom, I didn't know they were going to make me sick.
Exactly. And my mom said, my mom's anti-plastic surgery, by the way. I don't know how we're related. Totally anti. I'm like, who are you? Am I adopted? Like, for real. She's totally anti. But when I told her my symptoms and look, Mom, I had to prove myself to her. Because people were still, even in my immediate family, I love you guys with all my heart, but they were still judging. Are you sure? Are you doing this for cosmetic reasons? You're just trying to get another BBL? You're just trying to get us to help you, so you can get, no. And the more I showed my mom and my brother, who I talked about it the most, they were like, wow, really? It's a real thing.
Yeah.
You weren't kidding. You didn't lie. I had to prove myself to them in a way, but they were supportive at the end. Thank God. But I can't wait for them to see the new me. The new me, new and improved.
Yeah, I can't wait either.
It's crazy.
I'm excited because I can see it in you.
The eyes, Chico, they never lie. I had like the yellowy, I can't explain it. But if you guys look up that hashtag, BII awareness or whatever you want, that's what changed for me. And of course, that's what was life-changing for me. So if you're not crazy, because that's what a lot of people, you're just crazy. Oh, you're just a hypochondriac. Go with your own instinct.
Go with your gut.
Follow your gut. It doesn't matter only we know what we're feeling. No one can possibly know, not even a doctor, until you're going through it yourself. So do it. This is your sign.
Do it. This is your sign. If you're thinking your implants are poisoning you, just take them
Call
out.
Mavi.
Call me and I'll set you up.
Yes.
But get them out. Honestly, you guys, if you're having any of these symptoms, I'm telling y'all what my plan is. If I start to have any symptom that could possibly be related to any of these, to my implants, they're out. And you guys, the thing is, there's all this information about, you can only take it out in an embloc way. And when you take it out this way, that's the only way that you can make sure that none of that stuff gets out. And I don't know if y'all know, when they do embloc, they have to cut a piece of your
own tissue
out. And it's not a little bit, it's a lot of your own tissue. And there's a lot of risks associated to it. So a part of that, puncturing your lung. So I know there's a lot of doctors who like, oh, it can only be done this way, but that's not true. We're going to hear Dr. Hustak in a minute talk about, you know, everything that we do know and what the plastic surgeons as a society know and what they're putting out. And Dr. Hustak is part of the Houston Plastic Surgery Society. I think she's vice president, maybe.
She's amazing.
Correct me if I'm wrong. We'll find out here shortly. But this is like the common knowledge, right? Among them, among the plastic surgeons. And just how in the previous episode, I was talking to you guys about, you know, you won't go to your conservative doctor to ask for, you know,
everyone's going to have a different opinion.
2500 cc BBL. You have to find the right match, even for this procedure. And just because they're not pushing it out on their website, like other doctors, like the other doctors who do nothing but explant, like that is all that they do. Those are the ones charging how much? 20 grand plus just to remove it.
It's insane.
Just to remove it. So here, y'all know I can hook it up. So
call us.
Call me. All right. So now let's hear from Dr. Hustak. Hey guys. So we have Dr. Hustak with us now.
Hello.
So you guys, I was going to tell her everything that Norma told me earlier today, but I wanted to catch her reaction. I was like, hold on, let me push record because I want to tell you. Okay. So I saw her today. She's doing amazing. She's getting around. She's perfect. She went to dinner yesterday. Today she's perfect. And she is saying she feels her symptoms have been relieved. Some of her symptoms. Awesome. She said the main ones, like the pain in her hand, like the rheumatoid arthritis that she was experiencing in her hand. She's like, I haven't even thought about my wrist or my hands. She's like, oh, wait, my hands are supposed to hurt.
Wow.
And I wonder if we should phone her in. I've never done this. I've never done it. But so she can tell you.
I'm open to anything. Absolutely.
Let me call her. Let me see if she's available first, but we might.
But no, that's just wonderful to hear that she's feeling better.
With the BII patients that you see, I think getting into the BII, which she's like, I am convinced that's what I had. I know for sure. She's like, because I feel relief.
That's good. Yeah. So, this is such a wonderfully, while you're doing that, Mavi, I'll just chat a little bit. Let me start by saying, we don't really have a grasp on what breast implant illness is, right? There was tons of conversation about breast implants in the 90s. And I'm young enough that I didn't live through the 90s as a surgeon. And so this is kind of my generation's experience with this, but on a totally different level. So in the 90s, the U.S. took silicone implants off the market with concerns that they were causing autoimmune disorders. And we did unequivocally so many tests that was not the case. So that's not the same conversation we're having these days. The new conversation we're having is the symptoms that are coming around with some women with breast implants. And there's a whole conglomeration. I mean, there can be over 100 symptoms that some women talk about. Anxiety is a big one, chronic fatigue, headaches, memory loss, thinning of their hair and nails, GI problems, joint pains, muscle pains, so many different things. And lots of women feel better when they get their implants out with symptom control. And so this is something we're like, hey, we need to talk about this again because all women have a vested interest in making sure that our sisters are in safe things, right?
Right.
And our daughters, I have breast implants in myself. I've implanted sisters and mothers and best friends for reasons, one another outside of cancer and just for aesthetic purposes. And so we all have kind of a vested interest in making sure that what we're doing is safe from not only a plastic surgeon standpoint, but from a human standpoint.
Yeah.
Yeah, exactly. And so, so we're talking about this again, and the science is coming, y'all. I have two good colleagues that are doing some really good bona fide science on this, Dr. Pat McGuire and Carolyn Glicksman. And I was just at a conference with them last weekend in Dallas, and they're presenting some of their data they've been working on the last couple of years. That includes tons of symptoms, biopsy specimens, prospectively working with rheumatologists, endocrinologists. Like, this is fantastic data that's coming out. And I'm really excited to kind of see.
Wow, I'm so excited about that.
Yes, it's super, super exciting. And it hasn't been published yet, but some of the things that came out of it was that, more than we would expect from a placebo effect alone, women that are getting their breast implants out are seeing an improvement in their symptoms almost universally. Like you said, not completely gone, but absolutely an improvement. And so the question is, how can we identify these women that just may not respond well to breast implants? How can we identify them beforehand or even after to see if these are causing some of their symptoms? And that's really where the science is going to go. And I'm curious to see where that goes for sure.
Right. Because right now, is there a way to test before you get your implants removed? Because I know for patients, it can come to mind like, okay, what if I take them out and that's not even it? Or I really don't have anything. I don't want to be flat. I really don't want to take them out if I don't have to. Is there a test they can? Right now, there isn't, right?
No, there is not. No, there is not. And right now, we don't even have a way of identifying, even in some of these biopsy specimens, there's nothing equivocally that came out to say, oh, these women just may not feel, better with implants. Don't put them in these women. We don't have that data. There is no test, I think that there is kind of an increased risk of some of these symptoms in women that already have autoimmune disorders or have a genetic predisposition to them. Some of the Sjogren's and sclerodermas, for example, some of these women tend to feel better when their implants are removed. They already have the autoimmune disease, but are they reacting more to their implants? Maybe. We just don't know.
Interesting. Norma, she's unavailable at the moment. She said, I'm in a very loud place. I can't jump on the phone. She did say in her symptoms, I think Sjogren's was one of her things that she has and that she's feeling alleviated.
That's wonderful. Yeah. And that's kind of, these were put in electively and they certainly can come out electively. I think it'll be great when we can identify who we know will feel better. And we just don't know that yet. But certainly if you're having some symptoms and you're worried about it, I think it's, they were put in electively. We have lots of choices now that we didn't have before, like fat transfers and things like that that we can rebuild breasts with that don't involve implants, because as, our bodies become more immune reactive to our environments, which they are. There's lots of things about how we're interacting with our microbiome and our environment these days. Are we just reacting more to foreign devices? Certainly that could be the case.
That's so interesting. I'm really eager to see what these findings are, because I told the girls earlier, because the listeners, they're my girls. So I told the girls earlier, I already knew about BII before I put my implants in. And I kind of made that decision like, okay, I think it's an allergy like any other allergy. Like some people are allergic to peanuts. Some people are allergic to soy. Like some people can't have nothing with gluten. So I think it's, in my mind, it's something like that. So my thought process was, if I to start feeling any type of sick, like my first go-to is going to be take my implants out.
Right. And, it is, I think another important thing, Mavi, that we can talk about too, is one thing that I thought was really interesting that came out of this data was this concept of embloc capsulectomy.
I was going to ask you about that.
Yes. So I think this is like a one good first step for women that are having this surgery. Is there is absolutely unequivocally in this data coming out, no difference in improvement of symptoms between women that have had total capsulectomy, meaning taking out all the scar tissue, which is what every single surgeon does all the time for other reasons, versus an embloc or total precise capsulectomy. There is absolutely positively no difference in the symptom improvement. So what that means is that you don't need a whole breast to breast incision with a embloc 4-hour cancer operation to relieve your symptoms of breast implant illness. You don't need that. You need the implant out and all of the capsule, the pocket wrist, and your symptom control is absolutely identical to the gals that are having these massive, huge cancer surgeries for breast implant illness. And I think that's really, really important too.
You touched on something that I was talking to them about earlier, which was do not get pulled into the fear of you can only have it removed embloc and there's only specific surgeons who do it and that's it. Do not get pulled into that, because any board certified plastic surgeon can perform this procedure for you.
Absolutely. Yep. You don't need somebody that's microsurgically trained, which, by the way, we all are. Every board certified plastic surgeon is trained like that. But that's not what you need. You don't need a rim of normal tissue. You don't need to spend 4 hours in the operating room and all these scary things to get the breast implant out and all of the scar tissue around it. This is something that every single plastic surgeon does in their practice every single day, really, for capsular contracture, for other reasons where it's indicated. So yes, you don't need this huge, massive, 14 centimeter incision.
Can you explain to us the difference between, or what exactly an embloc is and what a complete capsulectomy is?
Okay.
Yeah, or total.
Yeah, for sure. Good point. Okay. So an embloc capsulectomy, or a total precise capsulectomy, depending on what verbiage you're using, is where you make an incision the same length of whatever implant went in, right? So most women that have like a 300cc implant, most of those times, those are 12 centimeter diameters, which is like 3/4 the length of most women's breasts, right? So if you have a 600cc, that's a good 14, 15 centimeter implant, which means I need to use the entire length of your breast in order to get that out.
Wow, I did not know that.
Yeah. So the idea with an embloc capsulectomy is that you enter the pocket and you take the entire implant inside of the capsule, oftentimes with a rim of normal tissue. So if these are below the muscle, that includes part of your muscle. That includes part of the covering of your rib cage to get these out. And we do these for cancer. Like, this is a type of cancer operation. And so that's originally when this came out, again, the science lag, we just didn't know. And we thought, well, maybe we should treat this like this is a cancer operation. And then we slowly discovered that's not the case. And now we have data to support that you do not need that for symptom control outside of cancer, right? And so that's the idea of the embloc, is you take out the implants with the capsule through a very big incision with a normal rim of tissue around it, oftentimes to make sure that you don't violate that capsule at all. And you take it out in one piece, which is embloc, one piece. That's what that means.
And the total capsulectomy?
Total capsulectomy is often where we dissect wherever we can get that safely. Usually, most of us put implants in through, a 4 centimeter to 6 centimeter incision max in order to get those implants. So we use the exact same incision we put your implants through to take it out. And so we enter the pocket like we normally do through a 4 or 5 centimeter incision, dissect around the capsule as much as we can, and then we open your capsule, take out your implant, inspect the capsule, and then grasp onto the capsule and take the remaining capsule out with the implant out. That allows us to be able to get onto the top, to get under your muscle more easily without the implant blocking our way inside that baby little hole, if that makes sense. So it's taking out every ounce of scar tissue the exact same way, just with the implant out of your body, so we can more easily see and take that through a small incision, just like how we put it in with.
Which, honestly, if I were to have my implants, if I needed to have them removed, that I would go with a total capsulectomy.
Right.
Sure.
That's not, and that's where the science is showing. You do not need this embloc capsulectomy for breast implant illness.
So what were some of these findings that you heard about 2 weeks ago?
Yeah. So I think, the data is going to come out with specifics on percentages, but just as a global arcing kind of interesting takeaway for me is there didn't seem to be one type of implant, for example, that was more associated with breast implant illness than others. It wasn't just, oh, this is silicone, or, oh, this is saline, which I thought was interesting, because some of our early conversations in the world of plastic surgery is that we were anecdotally seeing more patients with smooth round saline complaining of breast implant illness, which is a very different subset of patients that were textured silicone breast implant associated anaplastic large cell lymphoma. So it was almost like the exact opposite. So I thought that was interesting that there really was no difference in like a smooth round silicone, a textured silicone, a smooth round saline as far as breast implant illness. So more on that as the data comes out. The other interesting thing was that on the biopsy specimens, there was no smoking gun. There was no mold that was associated with breast implant illness more than others. There was no bacteria. There was no heavy metal. There was no one thing that said, oh my gosh, yes, this is what is causing that breast implant illness. There was none of that. And they actually took a lot of demographic data on tattoo percentages, for example, because we know there's a lot of heavy metals in tattoos. And so they even extrapolated those patients with tattoos and no tattoos and heavy metals in these biopsy specimens. And there was no smoking gun. So there was no, absolutely it's this heavy metal, absolutely it's this mold. There was no difference in a lot of these subsets, which I think is really interesting. So there was no smoking gun on the biopsies, at least from the preliminary data. So it'll be interesting to see when that comes out, what they'll say. But right now, there was just no one thing, because it would be nice to know that for sure.
And then there's the women who don't really want to lose their breasts. Like they're like, I was flat for a long time. If I really don't want to lose my breast implant, if I don't have to. I mean,
I think it's all about, conversations and education. I mean, I've certainly had women that have come in and just wanted to talk to me, right? Like, hey, because really you can find anything on the internet that supports your
argument,
thought, right?
on whichever side.
Yes, we call it consensus bias. You ask enough people that share your same view, you're going to get reaffirmation of your same view, right? Because you're asking a specific question that's leading you a certain way. So absolutely, I think that there's something to that for sure. And so I think having a conversation, I've had plenty of people that have come in. We've had the conversation. They've said, "Cool, okay, I'm going to continue watching it. I'll see you in 6 months, and we can keep filling out surveys on my symptoms, and I'll keep logs, and I'll think about it because I'm not convinced yet. And I just wanted to be kind of reassured where the science is and what you think. And I know that you're here if I need you, but I love my implants and I don't know what I want to do. So I've had that too, just that reassuring, like, hey, I'm here for you. Should you decide you need me? The science isn't unequivocally supporting X, Y, and Z, but if you want them out, let's take them out. Let's see, and I have some women that just say, no, I'm not ready. I just wanted to have the conversation with you. And that's okay too.
And that's perfect. And so if somebody were, like if a patient thinks, maybe I should get my implants out, what do you think their first step should be?
Yeah, I think the first thing should be to look at some of their metabolic stuff too. So I always ask my patients that they've seen their primary care doctor as well. Like, let's work through this algorithm. We've certainly had patients coming in with this conglomeration of symptoms, and they've found vitamin D deficiencies, symptoms of menopause, thyroid disorders. I've had a gal who had a brain cancer who thought this was their implants. Turns out it was a brain cancer the whole time that was causing some of these memory problems. So there are so many other things this could be besides your implants, right? So I don't want to go down this algorithm that's like, oh, absolutely, it's my implants, without doing an actual medical workup. Because lots of times this is your thyroid, right? We throw you on thyroid medications, you're perfect. You get to keep your implants too. It's a win-win. Yeah. So I think that's the first thing I tell people. Make sure you've seen a general doctor, share your concerns, and make sure they do a workup that kind of goes along with your symptoms. This is mostly a diagnosis of exclusion in my mind. So you work through the known medical entities. And if we're still not getting answers, let's give it a shot. Let's take them out and see how you feel. And lots of women do feel better.
And I mean, what else can we say? I don't want to scare anybody on the show into not getting implants because, I mean, what do we know?
Right. And we still put in way more implants than we take out. As a society, we study this every single year. We are absolutely still putting in tons of implants. So I agree. I don't want people to be like, oh my God, implants are bad. They're going to give me an autoimmune disease. That's not the case, but I am a big fan in listening to your own body. And if it's telling you something, sometimes you should listen. These were put in electively and I'm happy to take them out electively. And I think it's a good conversation if you have a really heavy autoimmune history and you've never had breast implants, to maybe have that conversation with your surgeon before you have implants to see if it's the right choice or if there's maybe something else like fat transfer that may be a better option for you.
Perfect. And I was just about to ask you, what are the other options? Okay, let's say I need to take my implants out. Let's say I've had them in for a long time and I've gone through weight gain and weight loss. And what can I do?
Yeah. So breast lift, depending on how much your skin is stretched over the years, adding in a breast lift sometimes can be just enough to rearrange your own breast tissue we already have to make them perkier on their own. We love fat. I love transferring fat from another part of your body that you don't want it, like your love handles, and putting it in your breast. I think that's a really great adjunct. I think the important thing to know is it's very difficult for me to take you from an A to a double D that's useful and perky with fat, right? So I think there's a difference in shape and volume. with using soft fat versus an implant. But certainly we can rebuild a breast mound with your own fat, with transfers of your own tissue to rebuild your breast, or even just lifting your breast sometimes is all you need.
Perfect. And, really the fat grafting, like I saw it on Norma. Look, you did an amazing job, Dr. Hustek. They look so good.
Awesome. Thank you. Yeah. She was such a great canvas. She was easy, but yeah, so I love being able to kind of use your own fat. I think that's a really nice adjunct and something certainly we're doing more and more these days. Perfect.
For our listeners, Dr. Hustek had Norma have a mammogram before.
Yes.
Why did you have her have a mammogram?
So I 1 in 8 women have breast cancer, right? So that doesn't negate the risk just with implants. And so I always just make sure we're not missing something before I go into a breast. So that doesn't even necessarily have anything to do with breast implant illness. That has to do more with her native breast tissue, because what I don't want to do is rearrange her breast tissue, add fat grafting, and there be something I'm missing like a cancer. And I've just disturbed her breast tissue. And now this becomes an even bigger problem with a breast cancer diagnosis. So that's actually what that's for, is to check the integrity of the breast implants and also just to make sure that her native breast tissue is good. So I feel very strongly in anybody above 35 that I get a mammogram on them anytime I touch their breast, regardless of the reason.
Perfect. I love it. And Dr. Hustek, this whole episode, it really kind of just fell together perfectly. And the reason why I wanted to bring it to the listeners is because a lot of patients, I feel, get afraid anytime they read about something, because I hear it in my DMs. I've been asked about BII, and I can hear the fear in their messages. I can hear the fear. And what I wanted to do with Norma is like, hey, this is, a recovery diary. This is her process. So this is somebody who has actually experiencing it and is living it. And you haven't heard her part or her portion earlier, because she said she was starting to just not even tell people that what she was feeling, because people were calling her a hypochondriac. She's like, I had to explain myself to my mom and my brother and my dad. Like, I don't just want to get more surgery. Like, I actually think something's wrong with me. I think my implants are causing me harm. And it just kind of fell together. All of this just fell together. And it's perfect, because this is real life. Like, this is how stuff actually happens. And what I want our listeners to know is that as the plastic surgeons, because I feel like you guys get vilified, either you put them in or you take them out, and you kind of can't, if you take them out, you better not be putting them in. And if you put them in, you better not be taking them out. Right.
This is not black and white, right? In the end, we're on your side as the patients. Our primary duty of any physician is do no harm, right? That's why we do what this is. We are people too. This just happens to be our chosen career, and so, we, in the end, I don't have to put breast implants in if I think they're safe, right? That's not where we are at all. I have so many other things that I can do to put in to build a breast. There's so many tools in my toolbox. This isn't my only tool. And so please know that we are not, implant. We are always on the side of our patients. And if the science tells us something different in a decade, we're going to follow the science and protect our patients. Because in the end, this is all about our ability to care for you and doing the best for you, without a doubt. So there is no black and white. I mean, I think we want to figure out who responds well and who doesn't, and how we can best identify that for sure.
And perfect. I mean, what more can we ask for as patients? I mean, you can't ask for anything more than that.
Right.
I think that's it, Dr. Hustek. You do so good. You're just so amazing. I love having you on, because you're like, bam, 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 get to the point. I know my and I love it.
I'm very direct. Anybody that sees me knows that I am, for sure. But I hope in a very empathetic way, right? Because I don't know everything either. But in the end, I just want to help you.
Exactly. And I think that's what I want, with this show, is to show more compassionate. The more y'all don't get to know the doctors. We get to know them. I get to know them. I want y'all to get to know them.
For sure. Well, you're awesome. Thank you for, doing something that brings light to something that's a really hot topic right now. I think it's an important conversation. So thank you for giving us a platform to exchange dialogue.
Oh, thank you, Dr. Hustek. And I hope to have you on again soon.
Absolutely. Thanks for having me. Everybody have a great night.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DM. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.